We're live.
Hello, students and friends. My name is Chris Wager, and I'm with the Central Asian Productivity Research Center. Welcome to our 2021 Autumn Lecture Series. At this time, please let me introduce Mr. Ron Melka. Mr. Melka has had a long and distinguished career in the field of public administration and education. He earned his master's degree in public administration with honors from the Illinois Institute of Technology. In 2007, he became an adjunct professor in the IIT Graduate Program of Public Administration, specializing in ethics, nonprofit management, performance measurement, and resource development. In his day-to-day job, he is the executive director of the Lyons Township Mental Health Commission. In this position, he oversees funding for mental health, substance abuse, and developmental disability services to the residents in the 17 communities within Lyons Township. He has served in many leadership positions during his career, such as Aunt Martha's Youth Services and Healthcare, President CPO for the United Way of Illinois, chaired the Illinois FEMA Emergency Food and Shelter Board, the Illinois Governor's Human Service Task Force, chair of the United Way of America Council of States, and he supports many local community groups and initiatives. With all that Ron does, it is amazing that he could find the time to be with us today. So in that case, Professor Melka, if you please.
Good morning. I would like to talk today about the pandemic and challenges to productivity. Thank you, Chris Wagner, for that wonderful introduction. I will cover what has been the impact of the pandemic on physical and mental health. Then we will discuss how those affect businesses, employees, productivity, and costs. Finally, I will give some ideas on what business organizations and corporations can do about this. Over 1 year after the World Health Organization declared COVID-19 a global pandemic, many adults report undesired changes to their weight, increased drinking, and other negative behavior changes that may be related to the inability to cope with prolonged stress, according to the American Psychological Association's latest Stress in America report. It shows that a majority of adults, over 61%, experienced undesired weight changes, weight gain or loss, since the pandemic started, with 42% reporting that they gained more weight than they intended. Such changes come with significant health risks, including higher vulnerability to serious illness from coronavirus. For the 18% of Americans who say they lost more weight than they wanted to, the average amount of weight loss was 26 pounds. Adults also reported unwanted changes in sleep and increased alcohol consumption. 67% said that they had been sleeping more or less than they had desired since the pandemic started. Nearly 1 in 4 adults reported drinking more alcohol to cope with their stress. We've been concerned throughout the pandemic about the levels of prolonged stress exacerbated by the grief, trauma, and isolation that our people are experiencing. This survey reveals a secondary crisis that is likely to have persistent, serious mental and physical health consequences for years to come. The pandemic has taken particularly a heavy toll on parents of children under 18. While slightly more than 3 in 10 adults report that their mental health has worsened compared with before the pandemic, nearly half of the mothers who still have children home of remote learning have reported their mental health has worsened. 30% of those fathers who still have children at home report the same. Of those who have been able to get help, parents were more likely than those without children to receive treatment from a mental health professional and to have been diagnosed with a mental health disorder since the coronavirus pandemic began. More than half of the fathers reported gaining weight, and nearly half say they are drinking more alcohol to cope with the stress. The majority of our essential workers, such as healthcare workers, people who work in law enforcement, fire, ambulance, say that they have relied on a lot of unhealthy habits to get through the pandemic. Nearly 3 in 1 say their mental health has worsened, while 3 in 4 say they could have used more emotional support than they've received since the pandemic began. Essential workers were more than twice as likely as adults who are not essential workers to have received treatment from a mental health professional and to have been diagnosed with a mental health disorder since the coronavirus began. Here's some of the pandemic's related stressors that have an impact on health. A major one is just the stress and anxiety of the coronavirus pandemic. This ongoing pandemic has many people more anxious and depressed and susceptible to take such extreme steps due to various reasons such as job loss, losing a close loved one to coronavirus disease, the lack of social gatherings, and so on. Doctors have observed an increase in the number of cases during the pandemic where many people have tried to attempt suicide or actually completed it. As per a study conducted last year on a sample size of over 1,000 individuals of the general population, we found that 55% of those who took part had a significant anxiety symptoms, and more than 1/4 of them were experiencing depressive symptoms. At least 27% of the participants claimed they had considered self-harm or suicide at least once, while 3% indicated they had recurring thoughts. People are afraid of getting the COVID virus, either themselves, their child, their parents, spouse, loved one, etc. They're afraid of contact with other people. If they've been isolated or just are meeting someone for the first time, they may be fearful. It could even be someone they had worked with for a long time, however, being isolated from them during the pandemic. There have been 5 million deaths due to COVID. 660,000 in the United States. Think of the families, the friends, schools, communities, churches, etc., that are in mourning and are fearful. This includes your employees and your customers. Many of them have lost their job, either themselves or a household member. And it's harder to fill vacancies right now for employers just because of the fear of people coming back or wanting to stay on whatever type of support they have, rather than going back into a stressful situation. There's another twist that could detour employees from seeking work. There's a renewed fear over contracting or spreading the COVID-19 as the Delta variant spark outbreaks, including breakthrough cases across the world. About 3.2 million Americans told the Census Bureau that they weren't employed from between August 2nd and August 16th of this year because of their concerns about the virus, which is up 30% from the previous polling over the last 2 weeks in July of this year. To be sure, that's only a small share of the overall ranks of unemployed Americans, who amount to more than 100 million as of the most recent census survey. The bulk of those without jobs, more than 42 million, said they were retired. According to the survey, many have taken early retirement because of the pandemic. The number of people staying out of the job market due to the pandemic now exceeds 2.5 million people who say they aren't working because their employer closed temporarily due to the pandemic. This includes restaurants, movie houses, hotels, airlines, other types of businesses that have a lot of public exposure or large crowds. More than 3.2 million people say they aren't working because they're worried about getting or spreading the virus, which is an increase of 30% from mid-July this year. Many are burned out and financially strapped, single parents who are struggling during the pandemic. Studies show that women have been hit disproportionately during the crisis. Of the more than 1 million workers over the age of 20 who left the workforce in September of last year, 86,000 of them were women, according to the National Women's Law Center. While jobs are being added back, women are still behind in those gains. There were still more than 2 million fewer women in the labor force in October than there were in February. A lot of women are feeling backed into a corner and really struggling both financially with what the virus is doing to them, but also personally. Results show that infection rates increase across communities. Individuals in low-income areas and those in poor health are higher risk. This means there's a threat of homelessness, eviction, foreclosure. A new report shows that 10% of landlords around the country collected less than half their rent in the year 2020. Landlords who own fewer than 6 units were most affected. One thing that's very clear is that we have no housing safety net. We are forcing low-income households and owners to essentially bear the cost of that in this current moment, and it's unfair to both parties. There's a lot of homeschooling and childcare challenges that employees may be facing. Nearly 1.1 million dropped out of the workforce. The rate of unemployment was even higher for women with children. In that same time, there were almost 1.4 million fewer moms of school-aged children actively working than compared with the prior year. Nearly 2/3 or 62% of adults with children say their additional childcare and virtual schooling responsibilities during the pandemic hurt their ability to get ahead at work. Many are trying to conduct 2 different jobs at once. They may be working at home for their employer, as well as supervising their child who is at home learning virtually because of the pandemic as well. Parents are feeling left behind in their careers and in their workplaces. Childcare and preschool admissions were hard to navigate before the pandemic began. For many parents now, early learning options simply don't exist. A little more than half of Americans live in areas without sufficient childcare, even before the COVID hit. The pandemic has compounded the challenges. Now, not only do parents have to be extra selective to ensure their child is safe, but they also have fewer providers to choose from. There's been an increase in suicides and mental health issues. Recent report shows that 70% of adults serving as caregivers reported adverse mental health symptoms during the pandemic. Parents or caregivers who have had support from others had lower odds of experiencing any adverse mental health symptoms. So support for those groups of people can be helpful. To protect their mental health, caregivers can seek social support, access mental health treatment, and give themselves a break. According to research, 70% of adults serving as caregivers report adverse symptoms related to mental health during the pandemic. Specifically, 55% of parents and caregivers reported symptoms of anxiety and depression. 58% reported COVID-related traumatic stress disorders, and 39% reported suicidal thoughts. In addition, parents and caregivers were significantly more likely to have mental health concerns during the pandemic than adults without these responsibilities. In the United Kingdom, numbers from the UK Office for National Statistics show that 1 in 5 people experienced depressive symptoms in early 2021, more than double the amount seen before the pandemic. There's been an increase in domestic violence. According to researchers, domestic violence tends to increase during times of stress. Scholars theorize it may be linked to the negative coping mechanisms. This seems especially likely given the context of the pandemic, where more people are experiencing prolonged contact with abusers alongside financial stressors. This is occurring as emergency and community resources have been overwhelmed. Domestic violence rates are increasing both in developing and developed countries. The number of domestic violence incidents in the US increased by 8.1% after the lockdown. The analysis is based on a review of 18 US and international studies that compared domestic violence incidents before and after the lockdown. Early reports on domestic violence only relied on police reports, but the final analysis drew data from police logs, domestic violence crime reports, emergency hotline registers, and health records. Every form of data showed overwhelming evidence of an increase in domestic violence. Domestic violence often goes underreported due to shame and fear, and is not always taken seriously by law enforcement. Lockdowns have also trapped more survivors with their abusers and made it more difficult to report incidences or have others intervene, creating what the United Nations is referring to as the shadow pandemic of violence against women. COVID-19 stay-at-home orders exacerbated factors associated with domestic violence, such as increased employment, childcare stressors, and poor coping skills, including increased alcohol and substance abuse. There's increase in alcohol and substance abuse impact both employees and family members. 1 year into the pandemic, increased drinking reported by Americans coping with pandemic school skills reveals that secondary pandemic health crisis with parents, essential workers, communities of color is more likely to report increases than other populations. Early in the pandemic, adults in the United States were drinking more alcohol to cope with the stress. More than a year later, those early spikes in alcohol remained constant throughout 2020, and in some cases soared even higher. People don't just increase their alcohol consumption for a month or two at the beginning of the pandemic. The trend held for nearly the entire year. In June 2020, liquor sales had surged 21% compared to the same month in 2019. In the United Kingdom, the national statistics show 1 in 5 people experienced depressive symptoms, more than double the amount, and about 1 in 18 with an alcohol issue. Only about 1 in 18 with an alcohol issue will actually seek support for a service. We're only seeing the tip of the iceberg. You might ask, why don't people get help? And the main reason is stigma. It's fear of losing their job, their friends, their family members, the shame on themselves or their family. You probably would not have too much concern having your child or grandchild going to someone's house who you know have diabetes or high blood pressure, but you would if you heard that they had depression, substance abuse, or some other mental health issue. There is a lot of social stigma, religious stigma, and shame related with these topics. Many people are afraid of the shame on their family, business prospects, if others knew the secrets they have regarding themselves or a family member. Now that we've covered what are the problems that have been exacerbated by the pandemic, I'd like to get into what are the costs that you would face as an employer or a business trying to deal with these types of problems with your employees, their families, their communities, and even your consumers. There is absenteeism, theft, and increased medical costs. Such a huge increase in employee mental health costs will also have an increase in absenteeism, both for employees with a mental health problem and those that have family members experiencing those. Employees with severe financial stresses, such as the loss of a job by a spouse, of the cost of substance abuse habit, may cause them to steal from their employer, either money or goods. If they don't have enough food for their family and they work in a food store, they may take some food home. If they don't have enough money for their rent, or for alcohol or drugs. They may steal both from their employer and from coworkers. Some COVID patients or their families have already received bills regarding COVID, even up to $200 just for routine screenings. Some of the highest bills are faced by those experiencing COVID, the COVID patients who require extensive hospital care, and most of those patients are now unvaccinated. Expenses can range from thousands to millions of dollars depending on what is required. Some patients have extended stays in ICU and may even require lung transplants. A recent Kaiser Family Foundation found that 72% of large health plans are no longer making COVID treatment free for patients. All of this has a huge impact on employee morale. Employee morale in many places is at its lowest point in years. Now, with the increase in cases, morale is dropping again due to the fear that what we thought was ending is now continuing in waves and spikes, maybe even indefinitely. So what can a business organization do to address these issues, decrease these costs, and hopefully increase productivity? The role of communication is critical during COVID. It's a key part of a business's efforts to build a safe workplace culture. Since COVID-19 remains an issue, this is even more urgent than ever. Consider how you are communicating and ensure your communication plan has the following characteristics. First of all, show honesty. The moment your team senses that you have been less than forthcoming on any issue related to COVID-19, you will struggle to regain their trust. Because of this, your communication must be consistent, straightforward, and honest. Have clarity. This topic does not leave room for interpretation. When you set your policies, procedures, and expectations, you must communicate them with clarity. Your team members should know exactly what you expect of them and how they should respond in any situation where COVID-19 exposure could be a factor. The same is with your policy on vaccinations, masks, distancing, etc. Use engagement with your employees. Communication about COVID-19 and related responses should be a conversation with them, not a lecture. Invite employees to ask questions and share concerns. Their feedback may reveal issues to you that you hadn't previously considered. Include COVID-19 education to your employees. Don't assume that every member of your team has an accurate understanding of what may have adopted some information. There's quite a bit of misinformation out there. Even intelligent people may have adopted some of them. Others may simply be unaware of what are the best practices or protocols that they should still be following. As you bring in new talent, think about your onboarding process. Consider making information about COVID safety available to all members of your team. Checking the chat box right now. No, I don't have any questions right now. As you bring in new talent, think about your onboarding process. Consider making information about COVID-19 safety available to all. It should include educating new employees about your COVID-19 policies. Creating a supportive work culture during COVID-19 is critical. When you think about workplace safety and COVID-19, you may focus solely on transmission risk. That's certainly important, but you're missing out on other opportunities to create a positive work culture in the face of COVID-19. Remember that the impacts of the pandemic have gone far beyond the health concerns of those infected or high-risk employees. There have been an increase in reports of anxiety, stress, depression, and isolation among workers that we've just covered in my lecture. What are you doing to provide mental health support to your workers during this time? Are you encouraging employees to engage in self-care, offering services such as employee assistance programs, or ensuring that you've created a culture that makes everyone feel welcomed and included? The effort you put in here will impact your employer, your brand, retention, and recruitment. Now let's look at COVID-19 well-being and report team management. You may assume that you don't have to worry about COVID-19 safety when it comes to your remote teams that are working at home. That's not really the case. In reality, COVID-19 has driven people to work away from the office and has resulted in new concerns. Just like you need to create protocols to ensure a healthy culture in your office, you have to do the same with your teams that have transitioned to remote working. Here are a couple of things you can do to support your staff working from home. Keep remote teams in the loop. As you build COVID-related policies, communicate these with your remote teams as well. Ask them to share their concerns and keep them updated anytime COVID-19 impacts the workplace in any way. Remember that your response to all of this impacts their perception of workplace safety. This could eventually influence their willingness to return to the office when time comes. Above all, show empathy to your employees. When someone moves from office to work at home, it's easy to assume that they will face less stress and inconvenience than workers who must continue to work in the office. It's true that remote workers no longer have to commute and have other flexible scheduling perks. However, they also have to make major adjustments, which aren't always easy to navigate. For example, your remote team members may be sharing resources with kids who are learning remotely or working with a limited space. Their technology may not be at the same level as at the office. Computers, cell service, bandwidth, etc. may be reduced. Be aware that people deal with a range of complexities, and adapting was something to deal with over the long term. Empathy will go a long way towards productivity and morale. What about those employees that are returning to the workplace? What are the workplace restrictions, scheduling, etc.? Some 41% of people currently working remotely say they needed more time than a week to prepare to return to the office. Among parents, 52% said they would need more than 1 week, and 35% would need more than 2 weeks. There are problems in hiring and keeping employees. What about drug testing? Job searches for remote work are up 460% in the 2 years since through June 2021. Interest has tapered but remained elevated even as the economy reopens, suggesting this trend to stay at home or work from home has staying power. It's unclear whether employers will meet the demand. Workers currently have more leverage in this current labor market that's extremely tight. It's unclear whether employers will meet the demand. Workers have more leverage now in this current labor market. The share of online job searches for remote positions has jumped in the 2 years between June 2019 and June 2021. That bump isn't siloed in a handful of occupations. It's widespread across a host of different jobs. So it's harder and harder to find workers. Regarding vaccinations, it's easiest to make the vaccine a condition of employment. Don't ask about a prospective worker's vaccination status. It's easiest, as I said, to make it a condition. Follow your government's Center for Disease Control and your local health department guidelines regarding this. You have to be very concerned about the security of your data and business assets. It can be a problem if there's higher turnover, disgruntled ex-employees, people who've dropped out of the workforce, or people that you've had to lay off and then are bringing back. Talk with security experts and your IT experts about how to protect your business. So what else can a company do about all of this? More solutions include that suggest that fully vaccinated people who do become infected with the Delta variant can be infectious. They can spread the virus to others. So just ensuring that people are vaccinated is not enough. This evidence has led our Center for Disease Control to update recommendations for fully vaccinated people to reduce their risk of becoming infected with the Delta variant and potentially spreading it to others, including wearing a mask in public indoor settings in areas of substantial or high transmission, choosing to wear a mask regardless of the level of transmission, particularly if individuals are at risk or have someone in their household who has an increased risk of severe disease or are not fully vaccinated, and getting tested 3 to 5 days following a known exposure to someone with suspected or confirmed COVID, and wearing a mask in public indoor settings for 14 days after exposure or until a negative test result. There's also been an updated guidance for COVID prevention in kindergarten through 12th grade schools to recommend universal indoor masking for all teachers, staff, students, and visitors regarding vaccination status. Face mask order requiring masks on public transportation conveyances and inside transportation hubs. Our Center for Disease Control has announced that it will be amending its face mask orders to not require people wearing a mask in outdoor areas. So who are your at-risk workers? Some conditions, such as a prior organ transplant, as well as prolonged use of corticosteroids or other immune weakening medications, may affect a worker's ability to have a full immune response to a vaccination. To understand more about these conditions, see your government's Center for Disease Control pages that describe vaccines for people with underlying medical conditions and a further definition of people with certain medical conditions. Employers should consider taking steps to protect these at-risk workers as they would unvaccinated workers, regardless of their vaccination status. One suggestion is that you could have incentives for employees to get vaccinated. An example is that a Tennessee school district is offering additional paid days off or sick days to incentivize teachers to get vaccinated against COVID-19. Another incentive is providing paid sick leaves to employees unable to work because of COVID-19, but only if they have been vaccinated. Some medical and insurance groups are only covering treatment for COVID-19 only if that patient has been vaccinated. If they have not been vaccinated, they will not have insurance coverage. Once people have returned to work, don't ignore your employees' fear or misery. Be aware that many workers are unhappy with their company's return to work policies. Rather than risk losing productive people, managers should confront employee dissatisfaction head-on. As organizations eagerly reopen their doors more than a year after COVID-19 pandemic began, many will be surprised to watch their employees walk out for good. Companies have been quick to set blanket policies that range from a full return to offices to fully remote models, often to their employees' dismay. If nothing else, the pandemic has taught us that the one-size-fits-all approaches can be extremely counterproductive. In fact, numerous surveys and news articles suggest that employees have been just as productive working remotely, even enabling their organizations to reach record profitability in many instances. So why are so many employers pushing so forcefully for all employees to return to the office, even as employee turnover across industries is increasing? Your first step in this situation is to take control. Applying this mindset, we recommend a strong and simple approach to leaders and organizations trying to steady their workforces after a year of pandemics. We call it TAKE, T-A-K-E, which stands for the T, take a strong stance. Employees don't want corporate platitudes or passive social statements after living in a pandemic limbo for so long. A, align your post-COVID employee policies, resources, and timelines like you would with any other business priority or client project. K, keep your word and follow through on your commitments. The point is most crucial. Employee trust is hard to regain once it's been lost. Execute your organization's post-COVID workforce plan in a timely fashion and evaluate your progress constantly. Ultimately, the TAKE framework is about confronting disengagement head-on. Too many managers put other business priorities ahead of addressing employee dissatisfaction. While this approach may be business as usual for many organizations, it can erode employee trust, hurt productivity, dampen creativity and innovation, and increase turnover. It's time to manage employees with more agency, flexibility, communication, and listening. This is a prime inflection point for organizations to figure out their new normal in the two-sided market of employee and employer relations. It's no secret that pandemic stress has inspired many people to prioritize work-life flexibility and wellness. Employees searching for a balance who are looking for organizations and industries agile enough to meet their professional and personal needs. Employees also have greater agency to demand the working conditions they want. In the past, employers have had the upper hand during times of economic uncertainty, but that is not the case now. Proactive leaders are accepting, even embracing this shift. Many are using systematic approaches to gather employees' insight and turn them into tailored workplace culture and policies. These efforts usually culminate in a strong talent management strategy with a deliberate timeline and action plan that boosts employee morale, retention, and productivity. Diagnostic tools such as surveys and small group discussions are critical to developing a more holistic view of the employee experience. In the U.S. Army, officers use command climate surveys to take the pulse of the people they oversee. Command climate surveys help direct reports, and junior level team members give honest, anonymized upward feedback to the organization and its leadership. Most importantly, the surveys assess overall workplace toxicity. When a company seeks inputs through surveys or discussions, execution is paramount. Surveys should be short and focused on a few key points to encourage employee engagement. To promote the most candid dialogues, an organization should segment members by seniority and leadership levels. Leaders may also want to seek guidance from an objective third-party advisor. A comprehensive approach can help reinforce the impartiality of feedback and the resulting action. As a starting point in developing effective tools and systems, we recommend that leaders ask themselves, what kind of employees work in my organization? Are they professional, skilled, unskilled, semi-skilled? How do my actions in areas of concern to my employees compare to the actions undertaken for specific business metrics that tie into my own promotions and bonuses? If there is a disparity, why is there a disparity? If people are leaving, why are they leaving my organization? How willing are those exiting to share in the reason for their departure? Exit interviews are very important at this point. Embrace smart thinking, meaning specific, measurable, achievable, realistic, and time-bound. This next component is particularly challenging for leaders. Compiling data, making a smart action plan, and setting a timeline. At this juncture, there are few paths that organizations tend to take, depending on their industry, size, and maturity. Some will devote a lot of time to compiling and processing the information. Some will focus on the easy external factors first, and some will buckle in for the hard task of organizational transformation. Typically, large and more mature organizations struggle with these changes more so than their smaller, more agile counterparts. Organizations might also pursue multiple paths simultaneously, varying the amount of time and effort on each stage. To be clear, moving too slowly is a major risk now. Spending a year or more developing a plan without concrete outcomes and developing plans that run counter to popular sentiment could prove disastrous for employers trying to retain professional and highly skilled talent. And while speed is required, leaders also need a long-term view. They need to envision practices that will become common practice, maybe even 30 or 40 years down the road. The decisions they make now could reshape business for decades to come. They must ask themselves, how will your progeny judge your stances as a leader and an organization? Be sure to include or expand your employee assistance programs to include mental health and substance abuse services. Employees may be afraid of seeking counseling due to the stigma and the fear of loss of job, status, promotions. There's several resources for employers to provide anonymous hotline or warm line counseling to their employees. A business can inform doctors and clinics in the community to use mental health and substance use screenage during regular office visits. Someone's more apt to visit their doctor than a mental health clinic. They're more apt to go in, and it could be for a sore throat or a vaccination or something else, than go to a substance abuse center. So if they're going to their regular doctor, it's critical that doctors and clinics use mental health and substance use screening during regular office visits to help provide those services or make referrals to those community members, employees, customers that may be experiencing those issues. A business may even have a clinic day at the workplace where employees can get vaccinated and have a health screening. Have employee education seminars. These could be lunchtime discussions. You could put up posters and cards and encourage employees to seek help for their physical and emotional problems. You can use social media, your web pages, Facebook, Twitter, TikTok, etc., to show concern, gather feedback, boost morale, have behavioral health apps that may anonymously provide help to your employees. Those that could increase overall mood, such as Mood Kit. There are therapy apps such as Talkspace for those that need mental health therapy. If they need to deal with stress and anxiety and looking for meditation, Headspace is a good one. There's suicide awareness ones like Better Stop Suicide. Other ones for stress include iBreath and anxiety, could be mind shift CBT. There's a large number of these, and any search in your area or your language will turn up a number of different free apps that your employees and their family members can use. You can have workplace support such as daycare. This can alleviate the stress of parents trying to find daycare or trying to deal with remote learning. Having some sort of support for that would be very helpful. Mental health first aid. As you would have regular first aid through your managers, through your employees, through your human resources staff, have those human resources staff and supervisors trained in mental health first aid. This covers how to identify someone with a behavioral health problem, how to respond appropriately, and how to get that person to professional help. You could set up anonymous telephone, video, and text help with professionals. These services are out there, and your business could advertise those or contract with those to cover the problems of your employees. You also have a community where your business operates, where your customers come from, where you're dealing with the local government officials and other organizations. How can a business or company address the impact that COVID has had on the community? Community programs can improve your image, your customer base, etc., because better communities have better customers, they have better employees, they have a better environment overall. You can do things that will both improve your community as well as your bottom line. One step is cause-related marketing. Cause-related marketing would tie your brand with being helpful to the community. It's a mutually beneficial collaboration between a company and a nonprofit designed to promote the former company's sales and the latter nonprofit's cause. American Express first coined the term in 1983 to describe its campaign to raise money for the Statue of Liberty restoration. American Express donated 1 cent to the restoration every time someone used an American Express card. As a result, the restoration fund raised over $1.7 million, and the American Express card use rose 27%. One study found that more than 9 in 10 consumers are likely to switch brands to one associated with a good cause, assuming that the quality and the pricing are comparable. People like to feel good about the companies they're using. Nonprofits can potentially benefit from the increased fundraising and exposure that cause-related marketing offers. Such partnerships, however, must be carefully considered, as they can pose risks to both parties' reputations. For example, a worthy cause could cheapen if consumers see cause-related marketing as crass commercialism. Look instead to some examples of successful partnerships at Selfish Giving. Another good resource is the book Designing for the Greater Good, the best in cause-related marketing and nonprofit design, which has numerous examples from cause-related campaigns, plus 24 case studies and increases into great nonprofit branding campaigns. For instance, if you're a bookstore, you could offer the opportunity for customers to donate toward literacy programs or books for local schools or other things that tie your brand of books and reading with a community need of literacy and books for local schools. You can also partner with a local mental health or COVID clinic in your area to address the issues of pandemic that are impacting all of us, and offer to donate a certain amount for every item that is sold or purchased from your business, or support the cause in other ways, such as employees giving a 1 day of service to help clean or set up or help a vaccination clinic site. Another thing you can do is look toward becoming a corporate socially responsible company. Corporate social responsibility is a form of international private business and self-regulation, which aims to contribute to societal goals of a philanthropic, activist, or charitable nature by engaging in or supporting volunteering or ethically oriented practices. Considered at the organizational level, corporate social responsibility is generally understood as a strategic initiative that contributes to a brand reputation. As such, social responsibility initiatives must coherently align with and be integrated into a business model to be successful. With some models, a firm's implementation of corporate social responsibility goes beyond compliance with regulatory requirements and engages in actions that appear to further some social good beyond the interests of the firm and that which is required by law. Businesses may engage in corporate social responsibility for strategic or ethical purposes. From a strategic perspective, it can contribute to the firm's profits, particularly if brands voluntarily self-report both the positive and negative outcomes of their endeavors. In part, these benefits accrue by increasing positive public relations and high ethical standards to reduce business and legal risk by taking responsibility for corporate actions. These could be environmental, these could be financial, it could be investment issues where a company refuses to invest in those stocks that are financially questionable or are creating harm to the environment or harm to particular communities or countries. These strategies encourage the company to make a positive impact on the environment and stakeholders, including their consumers, employees, investors, communities, and others. It could be that a business is only going to promote free trade coffee or other free trade issues that help support other communities. From an ethical perspective, some businesses will adopt corporate social responsibility policies and practices because of the ethical beliefs of senior management. For example, the CEO of an outdoor apparel company called Patagonia argues that harming the environment is ethically objectionable, and their stance is to only support those things in the product, in the production of their items that are not environmentally harmful. Finally, given the pandemic affecting all communities, social responsibility companies sponsor vaccination clinics and educational programs. This concludes my presentation. In it, we've covered what are the harm that the pandemic has done to our employees, our customers, and our communities, how that impacts our productivity and impacts employee morale, retention, and turnover, and what can a corporation do regarding dealing with their employees, communicating with them, being empathetic, devising plans to consistently work on bettering employee morale and productivity, and finally, what you can do regarding your community. That concludes my presentation.
Thank you, Ron. It was very informative and timely information.